Hello, everybody. This is Kristy. I'm reporting to the Healthy Rural California Board and leaders. We are so amazingly going in such great directions. And so I just wanted to take this moment. Today is June 5th, 2023, to give some updates on Healthy Rural California and the good work that is happening. Okay. It's a lot. And I am so grateful to everyone for your leadership, for seeing what could be, because really it's been 3.5 years. We got IRS approval for Healthy Rural California in January 2020. And in a relatively short amount of time, we have moved in some really great directions. Okay. So the first thing that I want to talk about is medical education. I really just thought, you probably heard me say this before, but I really thought in 2020 that this would be a part-time job. We'd have maybe a couple $100,000 a year in grant revenues that might ebb and flow. But just the graduate medical education work alone has been $5 million in grant funding. Is that right? Yeah, it's about $5 million to support the launch of 2 residency programs. And we are on track to be with those 2 programs about $5 or $6 million a year. So I'm going to give that overview really quickly now. You all know the psychiatry residency got accredited in February. Our first cohort of 4 residents will matriculate in 2024. We are on the path to finding out the best candidates for that first cohort and beyond. And it's just pure joy. It's pure joy to have been accredited so that we could do those next steps. And such great partners. A shout out to the faculty who have all been just giving so much that it's like almost a belief in the need for this program, because nobody's really been financially supported. There have been no stipends for the faculty available because we haven't yet drawn down the money from our state award, which I will describe. But in addition, we are very close. Did I mention it's June 5th? We're very close to submitting the family medicine residency application for accreditation any day now. I mean, literally, it's within the next 2 weeks that all of the parts will be available for the application, and then we can hit submit. That is a shout out to the GME committee. You will have to review the application prior to us submitting, because that is what ACGME requires. So psychiatry would be funded by Teaching Health Center funding, which is an award from the federal government. It has been historically $160,000 per year per resident, just straight up grant. And then the federal government had to renew this particular budget and forevermore. And so there has been agreement that would increase possibly to $210,000 per resident per year, which is a much more realistic amount. And a reminder, Healthy Rural California is not currently or yet planning to be a clinic. So we don't have clinical revenue to support the residency programs. So if they can increase it, that's a good thing. And $210,000 would really be an appropriate amount. So that's psychiatry. And then for family medicine, our primary hospital is Enloe Medical Center. We're so excited to have them as a partner and to see the wisdom of our collaboration, because bringing more primary care doctors to the region, both to serve as a resident in the 3-year curriculum in the region, but also to then be that sort of, 50% chance that they'll stay and practice medicine in the community once the residency ends is a fantastic thing. That program currently, as it's slated, would be funded through CMS reimbursement rates that would go to Enloe Medical Center, and then a certain proportion would come to Healthy Rural California. Will pay the residents, will maintain their the technology, and they'll get a cell phone. If you haven't been in a residency program in the last 10 years, it's a very different situation than years prior. And so we would be the ones at Healthy Rural California to do that. So in that regard, we are doing a lot of preparation for psychiatry, right? So we have to get part of ERAS, which is the match system profile where people apply, and then we go through and we do the selection committee through that. There's MedHub, which we have to get going, because that will be the platform once they're a resident. And we'll record their hours, faculty will record their milestones. So there's a lot of stuff we have to do. For family medicine, our goal is to have the first cohort of 4 in their 3-year program to matriculate in 2025. And then that triggers for Enloe their 5-year reimbursement cap. So I'm sure you've heard me say this before. I'm just going to quickly summarize. It's a CMS reimbursement law, which is you have 5 years to then establish all of the residency programs that you would possibly ever imagine, or have that many residents rotating through the facility at a certain point in time, 5 years from the first time the resident steps in your hospital or your clinic. And so we're really excited because Healthy Rural California, being the sponsoring institution, basically saves Enloe a year. We've already got the psychiatry residents. By year 4, they may be adding to that 5-year cap at Enloe. We have been talking to Dr. Maj at the Cancer Center. He's very interested in having the psychiatry residents as an elective in their year 4. So that all contributes to the number of residents to reach that cap. And then Enloe, we've found some funding with Partnership Health Plan to do what's called a initial feasibility evaluation. It's kind of interesting because it's not really a feasibility study, but it's the same words anyway. So that for Enloe to really assess, are they feasible for general surgery, internal medicine? Some community folks are really encouraging them to look at OB. And then somebody said the other day, pediatrics. So what would be Enloe's best opportunities for further residency programs so that we can start immediately helping get their maximum number of residents out there? And so if you calculate just having 4 residents per cohort for psychiatry, family medicine, general surgery, and internal medicine alone, that would be 52 residents. So it's really exciting. There's so much more that our team has been talking about. We would love to do an addiction medicine fellowship, sort of a partnership with Chico State for an MPH that would somehow be tied to the residency programs. It's just, there's so much wonderful opportunity that's coming from the graduate medical education work, and super proud of it. And I hope everybody in the community is proud of their efforts to do all of this work, because it's going to be a game changer for recruiting doctors to the area. So in that vein, we're creating a bunch of different fundraising opportunities. One is golf for more docs, walk for more docs, hike for more docs. You give me something and I'll run with it. Anyway, we're going to be looking at some fundraising because we will need to supplement revenue in a creative way and some annual giving. Looking also to talk to North Valley Community Foundation to set up a planned giving management of that account so that somebody can leave their legacy and leave as much money as they could in their trust or their will, so that Healthy Rural California would be able to benefit from those funds when it is time for the trust or the will to come true. And that would, it's a great way to leave a legacy. Honestly, I do that with my alma mater. For undergrad, they gave me 2 years of financial support at a time when I really needed it, so that I could stay at Barnard, my favorite. It was just, I loved being there. And so eventually, even though I was a single mom in like I think it was 2013 or 14, when I reached out and said I'd like to do a planned gift, because I can't give money right now, but or beyond, like, you know, a little bit every year. But I do know that I have assets that when I pass away, I would like a certain amount to go to Barnard. Now, that's what a planned gift is, and I'm excited to set that up so that Healthy Rural California could benefit from your wills and trusts and the legacy that you want to leave in the region. Okay, so the graduate medical education, so I'll be sharing more details about this fundraising campaign because it's multi-layered. It's going to provide a lot of different opportunities for support, and it just will become an annual giving request of everybody in the region. And just, I think it'll help. It'll be good to have some discretionary income that the board could then, you know, oversee and guide, because being tied to grants solely is kind of putting us in a box. I don't like to be put in a box. So, okay. The graduate medical education work is actually leading to a medical school. And it's those are big words. Those are big words. So bear with me as I describe to you how it's going to be possible. So we have a relationship with both Touro University College of Osteopathic Medicine and, of course, UC Davis School of Medicine. We have other affiliations, like with Stanford, we're looking at for an ECHO program. They would provide telepsychiatry throughout the region with our residents as the providers. Okay, it's another topic. Stay focused, Kristy. Okay, so we have agreed that we'll be developing regional campuses for Touro and for UC Davis. And a regional campus is really the year 3 of medical school, where the medical students have to do 12 months of rotations, typically 6 rotations. And one of those rotations is psychiatry. So we actually have that going, and then I think the family medicine residency as well. So we'll have faculty, we'll have the residents can teach the students too. And so this regional campus idea is a big lift because it could bring 20 to 25 students to Chico. And we're basically saying, you know, every physician almost has to become a faculty or preceptor in some way. And that's different and it's new and it seems overwhelming, but from all of the feedback that I hear from different areas, including our friends in Reading, that it is actually, it's joyful. It brings some new energy into your practice, into the hospital, and is actually kind of nice because sometimes, like especially with residents, they're actually able to do some of the work and expand the provider's reach. And so that's wonderful too. So, and then medical students are often in a shadowing sort of way. So it's not necessarily a lot of time teaching separately from the clinical work. Anyway, so I have a lot of enthusiasm for the medical school regional campus concept now that I get how fundamentally important this is for the region in the long-term recruitment of doctors, because nowadays medical students want to do their 3rd year or some of their 4th year clinical rotations as part of auditioning for their residency programs. They're already making their decisions about where they want to be or not be in year 2, looking ahead to year 3. I know that was kind of startling to me, but it makes sense. So they're already figuring out, okay, I'm really interested in psychiatry or family medicine, but without graduate medical education, our region has not been on their map. So now they get to say, okay, we would like to be in the medical students, year 2, would like to say, I'm really interested in the Chico area. And I know that eventually there's going to be graduate medical education programs, eventually, in the actually there will be. I need to use more definitive language. And then they get to say, okay, well, I'm looking at either Chico or somewhere in the Central Valley, and I'm going to choose Chico. So the medical student part of it is so important to this whole pathway of getting more doctors to the region of the rural and underserved areas of Northern California. So it's exciting. It's a big lift. I really need some funding. I really need to find someone who can become that medical director for UME, and then more staff people to support. It's actually a lot of work corresponding with the students. VSLO is the online program and we're getting that installed in the next 2 weeks, so that applications from the students can be better and more easily managed and streamlined. There's a heck of a lot of interviewing that they have to do. And we've been holding this under the psychiatry residency umbrella, but that's actually taking now away time from them doing the work for the residents, because the medical students are so eager to get involved and join us that I need to pivot again and look at different funding and staffing models to accommodate that. So it's wonderful. It's going to be great, and we're going to make it work. So that's medical school in a nutshell, but wait, there's more. There's great interest in a tribal medical school. And it doesn't have to be tribal per se, but we think that is very important for the region. There's also a need to help healthcare workers at every single person on what that means to have somebody who's from a tribal entity needing care. How do we align traditional medicine with Western medicine? How do we keep all of this, moving forward so that we can increase health equity and really tackle some of these longstanding health inequities and that should not exist anymore, right? It's, it's 2023. We can do things better and help everyone. So there is interest in that. And for the longest time, I just thought there's no way that there's enough to sustain a standalone medical school in Chico. There's just no way. But because I've been focused on this graduate medical education work, now getting into undergraduate medical education, we're actually building the foundation of what is needed for a medical school. So let's do this. And when I talked before about fundraising and leaving a legacy, these are you could help build a medical school in Chico through our fundraising efforts. It's pretty cool. It's pretty cool. So there's so much more that Healthy Rural California is doing. I wanted to be clear that HRC is now this fiscal and administrative oversight of the 2 medical societies, North Valley Medical Association, relatively new, and then of course Butte-Glenn Medical Society, which has always been linked to Healthy Rural California because our board at BGMS was the one that said, yes, let's create Healthy Rural California and then provided in-kind support to launch the psychiatry residency. So that's another thing. We have some grants that I do want to talk about, and I will, in terms of what's happening financially with those. But this big picture of Healthy Rural California having the resources now with our controller, Callie Erner, who is a CPA. We now have Isabella Gomez, who's trained to do the bookkeeping under Callie's supervision, and then to provide some of the administrative support that's needed for the medical societies to function. This also provides support if there's other small nonprofits that are in our realm. Public health, healthcare, healthcare workforce, any of those nonprofits. I've heard that the CAFP, which is the California Association of Family Practice Doctors, like it doesn't really exist in our region. I don't know, so whatever we all decide is helpful to manage and maintain, the Healthy Rural California Board can know that we now have a pretty darn good system for oversight of a fiscal management of these tiny nonprofits. So that's exciting, and I think we should all be proud of that work. It's no small feat to pivot that way, but if I can speak for BGMS and NVMA, it's possible that doors would have to be closed if things weren't done differently. And so Healthy Rural California is actually offering a sustainable model to go forward. So much of our grant funding is for the graduate medical education. I just wanted a quick update. There was an award in 2020 for $1.8 million to the county, Butte County Behavioral Health, for establishing the psychiatry residency, and Healthy Rural California is that key partner. We could not draw down those funds until we received accreditation. We received accreditation in February, and since then we've been trying to figure out how this all works. And everybody understands that in 2020, Healthy Rural California, Butte County Behavioral Health, and HCI, the State Department, we did not know much about graduate medical education. And so we're so thankful that the award was available and that we got to get that award, but we still don't have the funding. It is a reimbursement model. It depended on accreditation. And so I think we have just been awarded a 1-year no-cost extension for that award, in large part because the psychiatry residency, we had all these hopes that it would launch in 2023 with its first cohort of residents. And we quickly realized because of COVID that was not possible. And so the funding is actually needed through the end of June 2024 in order to successfully launch this residency program. And so that money is still being worked out, but it appears with Callie's good work that we are eligible for 1.2 million to the county, and then they take a certain, it's about 15%. And then the rest comes to Healthy Rural California. And that money can be used to reimburse Butte-Glenn Medical Society for their in-kind support, to North Valley Community Foundation, who loaned us $200,000 to get to accreditation, to pay for the faculty who they gave us a lot of time and wisdom and support as required for accreditation and for the program. And so we actually get to pay the faculty for last year's work. So that's exciting and getting closer every day to some funding. And then the family medicine residency grant of $2 million from HCI should be bringing $500,000 to Healthy Rural California sometime by July. That is, it's a different award. As I said earlier, HCI 2 was on a big learning curve. It is not a reimbursement model. It is much more reasonable, where if you hit certain milestones, you get a percentage of that grant. And so we actually came out of the gate as a sponsoring institution. And so we'd already hit some of those initial milestones soon after getting this award a few months ago. So that 500,000 should land soon. There is an unfortunate news in that we have we have two HRSA awards. One to launch the psychiatry residency, I think that's 500,000. And the other is, and that's a teaching health center grant. The other is a rural development grant for the family medicine residency. I think that was 750,000. I might have those two amounts reversed, but that one is demanding that we have 50% of our clinical facilities for the family medicine residency to be in a rural designated zip code per CMS, and Chico is not, but we're so happy to be working with Enloe Medical Center that we may have to either give back that award or sort of stop spending any more of that award. Thank goodness we have the HCI award from the state of 2 million. So I think we're going to be good financially for the family medicine residency anyway. But sad that even though so many of our patients are so deserving of having the family medicine residence, and it's just this very complicated designation. And HRSA is also new at giving out these rural designated awards to establish new graduate medical education programs in rural communities. So we're giving feedback very nicely that sometimes, you have a hospital in a zip code that is not considered rural, like in Chico, and yet that hospital serves 9 different counties, some of them even frontier. So, maybe their calculations need to be adjusted, but in the meantime, we have to follow what the current award is. And so we're still figuring that out. But as we get closer to submitting this application for the family medicine residency, it's clear that there's no way we would even come close to 50% rural zip codes. That's primarily going to be in Chico, and that's not a rural zip code. If you ever have any questions about that, Google mirural.org, and it tells you the breakdowns according to the federal government's guidelines on what rural zip code would or would not be. Okay, I need to sum this up because I really don't want these to be too long. I really want you to listen to them and hear this out, because there's just so many great things. We have a $500,000 award for 5 years. So that's 100,000. It's called HPPP, and it's pretty cool. I got to give Rachel Sanchez props because we are the only nonprofit that got this award. There's very little overhead allowed. And so it is primarily to give out stipends. And so a lot of colleges and universities went for this award, and they already had their existing staff set up. So it's really just to give stipends for learners to pursue healthcare workforce jobs through education. So we have 20 awards available, stipends available, and we are giving out, I think it's 11 at this time for the summer to high school students from Shasta County, Glenn County, and Butte County. Some of them are pursuing nursing, some of them are pursuing medicine. The remaining awards for the year will go to medical students who come to the area to rotate. Oftentimes they have to pay for that themselves. They have to pay for their housing. There's no sort of like additional money for them to come to the region, and yet these stipends are designed to recruit and develop pathways or help people along that pathway to either medicine or nursing. So all good. And that's very, very exciting. Thank you, Rachel, for submitting that grant and pulling together a really great curriculum. I think our first cohort of stipendees will be next week, June 14th, I think. And we have a classroom where they can gather for their kickoff meeting. And then Rachel's also been very involved with the Butte-Glenn Opioid Safety Coalition. I literally had to step out of it because I just didn't have the time. And so she has been doing a fantastic job and has landed 2 different awards so that we can become a naloxone distribution agency. Well, it's sort of spreading out naloxone distribution outside of Chico throughout the rest of Butte County, and managing some of those, or coordinating some of those partnerships. And in all of that, though, she has today submitted an application to SAMHSA that would help fund those works, that work for 5 years, I think, 3 years. It's a really difficult grant to go for, but SAMHSA's a challenging organization. It's well known to not be an easy way to get grant funding. So she's done a lot of work on this. And if we do get that funding, it would enable us to purchase a RV or van for our future residents to be able to go out to, more remote areas to distribute naloxone, and possibly do some screenings and, just help the residents connect and deliver care in a greater capacity. It's just a really great award. She did a lot of good work on it, and we're hopeful that, knock on wood, we can get that award as well. So, but we are moving forward with naloxone distribution because that award did come through, and so we've hired some folks to make that happen. And I'm putting together our next Advancing Health in Northern California magazine, and I have more details about all of those awards in the magazine. So other stuff, Rachel is writing grant applications right and left. So hope to have some more news about all of that soon. So I hope you feel good about Healthy Rural California. At our June 20th board meeting, Callie's going to share some of the more details on finances, and we can also share the 10-year projections that Morrison and Company did, and then hand it off to Callie. It's massive. It's almost mind-boggling at how quickly Healthy Rural California has grown, and knowing that we're going to grow some more, but how incredibly impactful all of this is, and I hope you feel good about it all. I'm looking forward to our 20th board meeting, and you can ask all the questions that you want, and I'll talk to you then.